Good morning, everyone. Today, Congressman Morgan McGarvey and I are here to discuss what's at risk for Kentuckians if the ACA tax credits aren't extended ahead of open enrollment this Saturday, November 1st. These tax credits help lower the cost of health insurance premiums. For millions of Americans, these subsidies are the only reason health insurance is within reach as the cost of living keeps going up. If these credits aren't extended, nearly 100,000 Kentuckians with insurance plans through our state marketplace called Connect could see up to 37% higher premiums for 2026 coverage. That's thousands of hard-earned dollars leaving the pockets of our families just to afford health insurance coverage, which I believe is a basic human right. In September, I sent a letter along with 17 other governors from across the United States calling on Congress to extend the credits. Yet here we are, more than a month later, still fighting for action to be taken. American families should never have to choose between affording groceries, paying the rent, and being able to afford healthcare coverage. Not extending these credits is going to force many of our neighbors to make very hard choices. For a typical family of four making $130,000 in Kentucky, the cost of annual premiums alone could rise by more than $12,000. For a 60-year-old couple making $85,000, it could rise by nearly $24,000. That's in just 1 year. And this comes at a time when families are already struggling to get by. Prices are rising due to inflation and tariffs. And the American dream is feeling more and more out of reach to so many. These problems are also made worse by the ongoing federal shutdown and the impacts of Trump's big, ugly bill, which is slashing Medicaid and will devastate the economies of many of our rural communities. Kentucky is going to be one of the states hit hardest by these Medicaid cuts, which could close 35 rural hospitals, cut 20,000 healthcare jobs, and threaten the lives of 200,000 Kentuckians who could lose all coverage. The combination of all these issues will have devastating impacts. Extending these tax credits is one of the simplest and most effective ways that can provide stability for the American people. And frankly, there is no excuse for action not to be taken. Either you believe that healthcare costs should be held down for the American people, or you don't. This is not a political issue, and the American people should not be used as a negotiating tool. Things like affordable health care, support for food, these are nonpartisan issues our families need and they deserve. And it's time that folks in DC stop playing games and put our American families first. Now, I know that Congressman Morgan McGarvey is fighting hard for Kentuckians in DC and has put this issue front and center. His advocacy is that Kentuckians already struggle to afford so many things, and many won't be able to make it if these premium costs go up. So I'm going to kick it over to him to discuss where things stand in Congress.
Thank you, Governor. Thank you for your leadership on this issue, for always standing up for Kentuckians and for the basic human right of people having health care. That's what we're fighting for in Washington right now. Let's zoom out for a second and understand what's about to happen and what's at stake. In 4 days, in just 4 days' time, every single Kentuckian is going to get notice in open enrollment, and they are going to see their health care costs skyrocket. Every single person, whether you're on the Affordable Care Act, whether you have employer-based insurance, you're going to see your health insurance premiums rise dramatically. And why is that? Well, first of all, you have to look at what Donald Trump and the Republicans did earlier this summer by making the largest cut to Medicaid in our nation's history, a move that in just a year's time will kick hundreds of thousands of Kentuckians off of their health insurance. Will have devastating impacts. The Kentucky Hospital Association is predicting if this continues to be the policy, you could see as many as 35 rural hospitals in Kentucky close. Well, you see that private-based employer insurance companies, they know what's going to happen, and they are making everyone pay for those costs that are going to rise. Then you have to also look at what's happening to the Affordable Care Act. In the Affordable Care Act, I was in the state Senate in Kentucky when the Affordable Care Act was implemented in our state. It moved the needle on public health more than anything we've ever seen. 440,000 Kentuckians got health insurance for the very first time. And when you look at who's on the Affordable Care Act, it's easy to see why. Over half of the adults using the Affordable Care Act for their insurance, they own a small business. They work in a small business. It has provided people the ability to have health insurance and to be able to afford it. But now, unless the House Republicans and Donald Trump act, those costs are going to skyrocket for every single Kentuckian, because the tax credits that are in place that make the Affordable Care Act affordable for so many of our neighbors right now are going to expire at the end of this year. And unless Congress acts, people are going to see their health insurance rates go through the roof. Now, we should have acted already. Earlier this summer, when Donald Trump and Republicans had their signature legislative accomplishment, they made the tax cuts for billionaires permanent, but they refused to talk about tax credits for people's health care. Because of that, in 4 days, when people get their open enrollment notices, they're going to see as much as a 10-fold increase in their health care. Our phones are ringing off the hook in my office right now. Just last week, I talked to a woman named Mary. She's 63 years old. She owned a small business for 23 years. Now she works in a small business. She's used the Affordable Care Act since it came out. She's just 2 years too young to get Medicare. And with this insurance premium, her monthly insurance is going to increase by over $900 per month. And that's just the premium. We know, as the governor talked about, that every good is going up right now. The cost of so much, because of the trade wars, because of the tariff wars, are going up, and people are seeing it in their drugs and in their grocery stores and all throughout their lives, whether it's at the grocery, whether it's the gas pump, whether it's with prescription drugs. So their premiums are going up, but that doesn't talk about the rest of it. The deductibles are through the roof for the healthcare. The out-of-pocket costs that people are going to pay are through the roof for healthcare. And Congress must act, because we can. We can do this. We can actually make sure that people can afford their healthcare, that every single one of our neighbors and friends in Kentucky has access to quality healthcare that they can afford. And we know that when we do this, everyone is going to be better off. But these stories do become very personal, because it impacts. And when people are choosing between whether they're going to have food on the table, or whether they're going to have health insurance, or whether they're going to pay for medicine or have health insurance, or even when their health insurance costs more than their mortgage, how are they going to live? It's important that we highlight these stories and what it means, and why it's so important for the House Republicans to come back to Washington and work with us to reopen the government and to lower the cost of people's health care. And to help tell that story, I want to introduce you all to a woman who I've never met in person, but she did call our office to tell us why this matters to her and how this is going to impact her. And with that, I want to introduce everyone to Ann Pipes.
Hi, thanks for having me. My name is Ann, and I live in Louisville, Kentucky with my husband and my son. I am self-employed real estate appraiser. I have been for over 20 years, and my husband works with me in our small business and is an independent contractor. We've been self-insured for over 20 years. That predates the ACA. And we're currently on a silver plan through our health exchange. That's not a fancy plan. That's not a Cadillac plan. That's a pretty base level plan with a high deductible. We do qualify for the tax credit, and thanks to that tax credit, our current monthly premium is $350. Without that tax credit, our current monthly premium is $1,275. So that's an increase of over $900 a month. We do not currently have an extra $900 a month in our budget. That current rate is higher than our mortgage. It would be, I'm kind of dreading for that notice to come through to see what the actual cost for 2026 is going to be. I've gotten a second part-time job to help make ends meet in light of inflation and market uncertainty kind of exacerbating all of those issues. Neither my husband or I are old enough to qualify for Medicare. So we're kind of stuck in limbo with this business that we built. And it's hard. It's going to be the first time in my adult life, if this does not get solved, that I'll be without insurance. And while my husband is fairly healthy, I have some medical issues like an autoimmune disease and asthma. So I've already started having conversations with my specialists and providers. My primary care doctor and I are having conversations about what type of care I need to kind of squeeze in before the end of the year in case this doesn't get solved. I'm starting, not with her permission, to ration medication to make sure that I kind of have some coverage so the impact will be a little lessened. So yeah, it's really stressful. I'm losing sleep over it. I think all day about what we're going to do if we lose health insurance. We have a son who's got a lot of medical issues. He still sees multiple specialists at Cincinnati and here in Louisville. Thankfully, he's covered by Medicaid right now, but with the changes that were in the most recent bill, even though he's a full-time student, I'm not sure what will happen to that and what's going to happen if we have to add him to our plan, or if we even have a plan. It's just a lot of uncertainty, and it's a very short turnaround time for that. I do think people just assume it's not going to impact them because, oh, I don't buy my own health insurance, I get it through my employer. But those plans that are on the exchange are the exact same companies that are offering insurance to people through their employers. And it's gonna, when people like me have to drop my coverage, when people who are healthier than me drop their coverage, that's just going to increase costs for everyone. It's going to push people to avoid preventive care. It's going to push people to using emergency rooms for care, which is just stupid. That's an expensive, stupid way to get care. It's not a very cost-efficient way. It's not a very compassionate way to get care. It's not fiscally responsible to put people in a position where they're getting their care through emergency rooms. And it's, it's going to be really hard. And I know that the healthcare system is broken, but to think you're going to fix it in a month is silly. We just need to kind of resolve this. We need to triage this problem now. So I appreciate Representative McGarvey having me on. I appreciate him foregoing his paycheck during the shutdown. I know not everyone is doing that. I appreciate him being in Washington working. I know not everybody is doing that. And I appreciate Governor Beshear for always showing compassion and helping in any way he can, and for having me here today.
Well, thank you, Ann, for a powerful and painful reality. An independent contractor and a real estate appraiser. I'd call you all a dual income family, but you're working an extra job. 3 different jobs and still struggling. I think this shows why action has to be taken, why we have to extend these credits, and it needs to be done immediately in DC. All right, we've got some media on the line. I'll identify the reporter. If you would please direct your question to one of the 3 of us, and we'll move down the list. It is a long list, but this is an important topic. We'll start with Hannah Pinsky from the Courier-Journal.
Good morning. This is a question, I guess it would be toward more so Representative McGarvey, but wanted to ask about the promises from Republican leaders that they have said they will negotiate on this ACA tax credit extension after Democrats support the short-term government funding bill. I'm wondering, what are your thoughts on that sort of strategy that the Republicans are pitching to Democrats? And is that something that the party should consider given the impacts that this government shutdown could have moving forward?
I want the government to open back up, and I want these healthcare tax credits extended. The House Republicans need to come to Washington to actually make that happen. They are not here right now. The president is in Asia. He is not here right now leading on this issue. So every chance we've had, whether it was this summer when they passed the largest tax break for billionaires ever while making the largest cuts to Medicaid and to SNAP programs in the same bill, they refused to even talk about the Affordable Care Act tax credits, which were also set to expire at the end of this year. They have shown no willingness, no plan, or no good faith in the negotiations so far. I'm willing to work with anybody. I'm willing to work with anybody to get this done because, as the governor said, this is not a partisan issue. People being able to afford their health insurance is not a partisan issue. This is something that impacts every single person, urban, rural, Democrat, Republican, everywhere in the country. That's why we need to go ahead and come back to Washington, open up the government, and make sure that these tax credits are extended so that people can afford their health care.
Next, we have Lisa Autry from WKU Public Radio.
Hi, Governor. I'm just curious, is there anything the state is looking at doing? Is any kind of state intervention if the tax cuts expire?
Oh, when you look at this program nationwide, it's enormous but necessary. No state is going to be in a position to be able to make up for the federal tax credits that are there. It would take a massive change on the state level, which would require acts of the General Assembly. So there's not going to be immediate relief, I believe, in any state around the country. This is all entirely on Congress. And listen, they voted not long ago to continue a tax cut. And what Congress said, what the Republican leader said, is this is relief that families are currently getting, and we don't want to eliminate that relief. Well, that is the exact same here. You know, they were willing to continue a tax cut that primarily helped wealthier individuals. Are they really not willing to continue this tax credit program that helps those that are struggling? Well, that puts who has what priorities in clear focus. Tom Latek, Kentucky Today.
Thank you, Governor. Good morning to you and good morning to the Congressman. This one is for the governor, if I may, and that is, well, this is end of the year where all these changes are going to take. Come Saturday, SNAP benefits will be gone. Is there anything that the state can do to shore that up while they're waiting for the government to reopen?
The USDA sent every state a letter saying that they were not allowed, that they were prohibited from working with vendors that provide those SNAP benefits. So this isn't just the Trump administration saying they're not going to fund it. They are actually prohibiting us from doing certain things as well. But this is about $100 million hit to Kentuckians. The sad part about this is there are emergency funds that are right there. All the Trump administration has to do is say, we're going to use them. In fact, the Trump administration is talking about providing Argentina a $20 billion bailout during a government shutdown, but won't provide SNAP benefits, food assistance for our own people. That's not very American first. James Pilcher, WKRC. Okay, let's go to Olivia Russell with WAVE.
Good morning. I have a question for Governor Beshear. As we just heard Ann discuss the way she's preparing to lose insurance, do you have any advice for Kentuckians who are in this position to kind of take that proactive step to prepare for this whenever it really sets in and they don't have insurance anymore?
Yeah, I want to thank Ann for sharing her reality. I don't want to call it her story because what she's facing right now, I hope Congress will fix, and it won't be her story moving forward. But I think folks in Ann's position do need to be seeing their doctors right now, need to be talking about what they can do, what course of treatment they can follow. Hearing that anybody is having to ration their medicine hurts, and no one in our country should have to do that. What this administration and congressional Republican leadership are doing are ultimately forcing people off of coverage, whether it is Medicaid or private insurance, which is going to make people less healthy. They're going to live less long. Their quality of life isn't going to be as good. They're not going to be able to be in the workforce like they were otherwise going to. It's going to make our country significantly less productive, and it's mean and it's wrong, and people are going to suffer. Sylvia Goodman, Kentucky Public Radio.
Thank you, Governor. I have also a question about SNAP. You mentioned the fact that the letter said not to work with vendors. We're seeing other states, though, take some amount of action. For example, Minnesota is putting some money towards stocking food shelves. Is the state considering anything along those lines?
Yeah, we're looking at what options are out there. The first thing that we have done, which will help some of these same families, is to fund TANF for this next month. That is a program that helps struggling families for a period of time find stability. That's about a $12.5 million hit that the federal government is not providing, that we are moving dollars into there. We're having conversations with some of our food banks right now. We are limited compared to some other states in that Virginia looks like they're trying to do a state of emergency, which opens up certain funds. Now, our General Assembly passed legislation that caps the amount that we're able to use over the course of a biennium for states of emergency, which we've had to have a number of them with these natural disasters. I'm doing everything I can to push this federal administration. They can fund SNAP during the government shutdown. They should fund SNAP during the government shutdown. Whether people have enough to eat should not be a prop for negotiating. Sarah Ladd, the Kentucky Lantern.
Thank you so much. My question is also for Governor Beshear. We have seen some discussion of states considering suing the federal government or taking other legal actions over withholding SNAP. Is that something Kentucky is looking at or interested in any way?
We are absolutely looking at it. We have previously sent, I believe, a letter with a number of other states about this coming up. But yes, we are in active discussions about that. The law that creates SNAP says it shall be funded. Many years ago, when Ernie Fletcher and the General Assembly here couldn't reach a budget, the Supreme Court ruled that there are some statutes that are self-appropriations, that you don't otherwise have to have a budget to go ahead and fund. And that same, not theory, it's the law, at least in Kentucky, I believe could and possibly would apply to the SNAP program. But there are emergency funds sitting around that the president could use to fund the SNAP program. All he has to do is be willing to do it. Aaron Kelly, Spectrum.
Thank you, Governor. This question's for you. I just wanted to mention, we're talking about grocery prices. The president has said that they're working to lower beef prices by bringing in Argentinian beef. And we're seeing that the Kentucky Cattlemen's Association is raising concerns about that. Do you have a comment on that strategy and potential impacts on Kentucky's cattle farmers?
The president's tariff policies and his foreign policy are hitting farmers especially hard, and they're noticing. Look at soybeans. We'll see what this new deal with China is, but at least for this growing season, if not going forward, China has placed orders with Argentina and with Brazil. If we lose that market for our farmers, which grow corn and beans, and basically so do so many throughout the Midwest, farmers are not going to have the markets they need to sell their crops, especially once USAID was eliminated. Then you look at cattle, and here is a president trying to make a deal with a country that just accepted that order from China, which is going to hurt our soybean farmers. The president is talking about a $20 billion bailout for that company. And now this potential deal on beef, which is going to hurt our cattle farmers. Again, if we come back to what we're doing today, if you've got $20 billion you can spend in a government shutdown, in Argentina, certainly you can redirect all or most of that money to help our families during the shutdown for SNAP. Beth Musgrave from the Herald Leader.
Yes, Governor. I was kind of curious. We've seen various numbers on the increase for the premiums. Do you know where that 37% came from? Is that an average or?
Yeah, that came from our Cabinet for Health and Family Services, and I'll have our comms group send you extra information on that. We'll get you exactly how that number was calculated. Kimberly Keegi from WSAZ.
Hi, Governor and Congressman McGarvey. Thank you for taking the time to address this issue this morning. I was curious because the average salary that you guys were talking about for a family of four is much higher than the reality for a family of four actually sees. So are you expecting this to be even more drastic, for people who live in Kentucky?
Congressman?
Sure. Thanks, Governor. Yes, I am. That's a great question. In fact, you can go on right now and window shop on the Connect website. So go take a look. For instance, we plugged this number in last week. If you take two 40-year-old parents who are in good health and don't smoke, each make $55,000 a year at $110,000 a year, which is still a lot of money. They're going to see their health insurance premiums skyrocket. Now, if they have two kids, and I plugged in a couple of different numbers, if they have two kids ages 8 and 10, or they have two kids ages 2 and 4, their health insurance premium number stays the same. But this is important when you look at young families. If you have two 40-year-olds who are still making decent money, $55,000 a year apiece, they're both working. They have kids ages 2 and 4. Their health insurance rates are seeing the same drastic, incredible increase. I mean, you're looking at $900 a month or so increase over what they're paying right now. They're still paying for childcare. Now, how can any family afford that type of hit? And by the way, the plan we were looking at, I should make this clear, the plan we were looking at was the lowest cost plan available. So they're looking at the lowest cost plan available. That means their insurance deductible on that plan is $10,600. So you've got childcare costs. You've got your health insurance going up by over $900 a month. You now have a $10,600 deductible. And one of the things that Ann mentioned, it's getting lost in this whole conversation. The House Republicans and Donald Trump are driving the cost of healthcare through the roof. But you know what's still going to happen? People are still going to get sick. Kids are still going to fall and break their arm or need stitches. Parents and adults are still going to have pregnancy and heart attack and stroke and cancer and things that just happen in life. So you look at a family of four, if a kid breaks an arm or they have a couple of hospital visits or flu season's particularly bad, that $10,600 deductible gets eaten up pretty quickly. Now all of a sudden you're looking at $30,000, $40,000 out of pocket costs, after tax dollars for a family making $50,000, $55,000 a year apiece just to have health insurance, to have childcare. You're not talking about food on the table. You're not talking about a roof over their heads. That's why this is so important. That's why we are taking such urgency with this. It's why I'm so grateful for Governor Beshear's leadership on this issue and continuing to press the federal government and talking about this in a way that it is. This is our neighbors. These are our friends. These are people who are just going to work and trying to do the right thing and make sure that they can have health insurance for themselves and their families and be able to put food on the table. And this administration in Washington, and the fact that the House Republicans aren't even coming back to deal with it, it's mean.
Sydney St. Clair, WTVQ.
Governor, Congressman, thank you for talking with us today. My question kind of really can go to either one of you. For families and small business owners currently insured through Connect, what specific options will they have to help offset these higher premiums once open enrollment begins?
They're not going to have good ones. Without the extension of the tax credits, what's going to be available to them is simply going to cost a whole lot more. That's why this thing is so clear, so simple, and if it's not done, so cruel. Because that small business owner, if they are going to have healthcare coverage, it's going to cost a lot more unless Congress acts. So the sad choice that they're going to have is either have healthcare coverage or not.
And Governor, if I can just add one more thing to that briefly, this impacts everyone, and I want to point that out. We had someone call our office this week already. He's on the Affordable Care Act, but his income level is such that he doesn't actually get the tax credits now. And he's looking at his premiums going up $300 a month just because of the fact that tax credits are expiring and how they think that's going to impact everyone else. So the fact that Congress is refusing to deal with this right now, that the administration is refusing to deal with this, it is going to impact everyone. And there's not a lot of good options unless Congress passes these tax credits.
And that means we're going to see our uninsured rate go up, which means our hospitals are going to take another hit on top of the big ugly bill because there are going to be fewer covered patients that are coming in and more emergency work that has to be performed without compensation. So Laura Glasscock, the Kentucky Gazette. Okay, Karen Czar, WUKY.
Good morning, and thank you. This is for you, Governor, and Congressman McGarvey. Ann mentioned, and you both just touched on the fact that there is a misconception that the increases will only affect those who purchase insurance independently, but that this is going to, in a sense, affect those who also get insurance through their employer and hospitals. Can you elaborate on how this is going to trickle into everyone's coverage, in your opinion?
Congressman?
Sure. Thank you, Governor. So when you look at what happened, and I don't think it's a big, beautiful bill, but what happened with the House Republicans and Donald Trump this summer when they passed what they referred to as the one big, beautiful bill is the largest cut to Medicaid in our nation's history. It is going to kick hundreds of thousands of our neighbors in Kentucky off of their health insurance. So if you have a private employer plan right now, those private insurance groups are already seeing how many people are not going to have insurance. And factor in the fact that tax credits haven't passed yet and that those costs are going to skyrocket. Some people are going to choose not to have health insurance as well. Well, guess what? People are still going to get sick. People are still going to have emergencies. People are still going to be going to hospitals and getting care. Even if they don't have health insurance, they're still going to be possibly going to the emergency room, maybe not being able to pay for that care as they are now. So private insurance, they're seeing that, they're anticipating it, they know it's going to happen, and they are going ahead and increasing the costs of everyone's health insurance to offset that because of what Congress did and what the Trump administration did. Now, that's the double whammy of looking at what we're doing right now by not passing the tax credits in advance of open enrollment. People are about to get these notices, as Ann talked about, as I talked about Mary, who called my office. There's so many people who are calling their offices right now as they're looking online. This is before the notices even go out. Those notices go out on November 1st. And they are going to see their health insurance premiums just skyrocket. And I stress it's their premiums. Keep in mind, this is just the premium for having health insurance. It doesn't mention the copays. It doesn't mention the deductibles. It doesn't talk about the out-of-pocket costs for prescription drugs, which because of the trade policies of this administration continued to rise. The cost of food, which is continuing to rise because of the trade policies of this administration. So everybody is getting pinched in every direction, but we can act. This is the thing. We can do something about this, and we know what works. We know that it is ultimately better and cheaper for every person to have access to affordable, quality health insurance. It is something that when we invest in on the front end, it makes it cheaper on the back end, and it's the right thing to do. And so that's why we in Washington, why I'm here fighting, why I'm saying I will work with anyone. Let's open this government back up. Let's make sure that we are lowering the cost of Americans' healthcare because it's the right thing to do. And it's going to have an impact on everyone if we don't.
Next, we have Carly from WKYT.
Thank you, Governor. You mentioned impact on Kentucky's rural communities, including hospitals. Can you kind of expand on what a continued government shutdown might mean for them?
Well, what I'm talking about in terms of rural hospitals is a hit from the big ugly bill and then a second hit if Congress fails to extend the tax credits. So the first hit is cutting $1 trillion from Medicaid. and those dollars flow through our healthcare system, and more of those dollars flow through rural hospitals as a percentage of hospital revenue than in other hospitals. And so we already expect a significant hit just from the big ugly bill. The Kentucky Hospital Association estimates 35 of our rural hospitals may close, 20,000 employees will lose their jobs, 200,000 Kentuckians may lose their coverage through Medicaid. Now add this piece on, because these are insured patients that make up the other part of the revenue of those rural hospitals and reimburse more. When someone with coverage goes into a hospital, that hospital receives more revenue for that insured individual than someone on Medicaid. And so refusing to extend the tax credits means less people will be able to afford insurance, which means, again, not only a hit to that family, but a hit to each and every one of these hospitals that employ so many Kentuckians. Carolina from WLEX. Okay, I think we have someone from WLKY. All right, then the last person on the line, I think we now have James Pilcher
Governor?
or someone from WKRC.
Hi, Governor. This is Madison Elliott with WLKY. Actually, question for Congressman McGarvey. With these tax credits, has there been any conversations going on behind the scenes about potential compromises with these tax credits, either grandfathering those enhanced tax credits or extending the subsidies of changes? What do those conversations look like?
Yeah, and I'm in DC now. I've been in DC every week since the government shut down, willing to work with anybody to make sure we get this done. And yes, when you look at this, the fact that people's health insurance is going to skyrocket, it is not limited to Democrats and Republicans or rural and urban areas. Everyone is going to see their health insurance costs increase. That's why we are trying to work across the aisle in a place where the Republicans control the House to make sure they see the importance of this and are willing to lower the costs of health insurance for Americans. But I will say this, they have to come to Washington to actually do it, to open the government back up and lower the cost of healthcare. We're here ready to do it, and we want them to join us.
WKRC with our last question.
Thank you. Nuts and bolts question for Congressman real quick, and then a broader question for both of you. The nuts and bolts question is, okay, so if you're able to include this in some kind of settlement, let's say in 2 weeks or a month, could it be retroactive? I mean, the deadline is Monday. Could you make this extended? How could that work? And here's a question for both of you. What else can each of you do to help solve this situation, given the impasse in Washington? Thank you.
We should do this now.
Sorry,
go ahead, Governor.
Go ahead, Congressman.
Go ahead, Governor. Go ahead, Governor. I was just going through the nuts and bolts. We should do this now because people get that notice on November 1st about their health insurance. Some people are looking right now, some people aren't. I think people are going to understandably freak out when they see how much their health insurance is going to go up because Donald Trump and the Republicans are refusing to act on this. We should do it now. Now, the tax credits don't expire until the end of the year. So yes, Congress can act before the end of the year, but we should do it now while people are making their decisions for their families. When budgets are already spread thin, when they're already wondering between school supplies and kids' sports and food on the table and medicines, that whether they're going to have health insurance, we should do this now to make it easier for families today.
It'll be really challenging if something is not done during the open enrollment period, because during open enrollment, you select a plan, you sign a contract with that insurer, and changing that afterwards is going to be challenging. Now, I want these extended. They really need to be extended before the 1st, but they certainly have to be extended before the end of the year. And the challenging thing, when there are huge cuts to Medicaid and or failure to invest in continuing these tax credits, states are not in a place to be able to step in and fund. Now, we will do any and everything we can. We are applying for the Rural Health Transformation Fund, but those aren't dollars that are aimed at going to rural hospitals, even though that's what we were told when it was passed. It's very clear in the application that we have to send that it's intended for other types of programs that we hope we can do in coordination with rural hospitals. But because of the big ugly bill, and if Congress doesn't act here, I don't want to sugarcoat it. It's going to cause a lot of pain to our people, both individually in their healthcare options, as well as healthcare as a massive employer and part of our economy. All right. Thank you all very much for joining us. We appreciate it. And that is the end of our press conference.